Good morning, everyone. Today I'll demonstrate cellulite treatment using Celluex, which is a septal release technology. This is a live walkthrough where I'll show patient selection, marking, depth control, septal identification, release technology technique, and post-procedural care. The key concept to remember is that cellulite is a structural problem caused by fibrous septa tethering the skin, and Celluex releases targets the cause itself. How to position the patient. Positioning the patient, the marking should be done while the patient is standing, because when they lay down, the cellulite will disappear and you cannot see it. So the patient would stand. You should have good lighting positioning in the room, so you can see the dimples and you can start marking them. Looking for our discrete, well-defined dimples, the same as the ones here, the ones here, the ones you can see on the posterior thigh. This indentation is caused by a single dominant fibrous septum, which makes it an ideal target for Celluex. So, marking the patient. I mark only the visible dimples, not the entire area. Each circle represents one septal tether. It is not a treatment zone. And avoid over marking the patient because it might cause skin laxity. So, for example, this area is a no-go zone because it is caused by skin bulging, and it wouldn't help this area. What you ask the patient is to tighten their buttocks. Please tighten your buttock. You see these areas. These are cellulite areas. So you mark them each, and then you turn the patient to the side. There is another one here. You can find one about here also, which you can treat if you can reach. The incision is done exactly at the inferior gluteal fold crease. And it would show even better well in different, when you turn the patient around, you would see the cellulite under good lighting conditions. For the posterior thigh, you would ask the patient to put her legs backwards, so you would see the cellulite fibers. You would see some here, and there is one here. We might be able to reach it if we do our incision in the crease here. So we took another angle where you can see the cellulite also better. This is another one. Now we'll turn to the other side. There is one here, one here. Tighten, please. Tighten the buttock, yes. Okay, more. Tighten it again. This area you cannot go because this is the banana. This is caused by fat bulging. This is not cellulite. Caused by fat bulging. If you release it, it wouldn't help much. It would might make the banana roll a bit bigger then. The most important part is to take pre-op and post-op. When do I recommend to take the post-op pictures? 3 months post-procedure, because the result will show after 3 months. And you have to have the documentation so you can show the patient the difference after 3 months. Prepping the patient in the prone position. Our incision is done in the inferior gluteal crease. We infiltrate it with local anesthesia, and then we use Thomasin solution to infiltrate the whole area where we're going to use the Celluex. The Thomasin solution we are using is 35 ml, 2% lidocaine with adrenaline, and 500 ml normal saline. The goals of the Thomasin solution are analgesia, hydrodissection, and hemostasis. So this is our incision site. So we infiltrate the Thomasin solution. The procedure is done under local anesthesia. Some sedation could be also given if the patient is a bit worried. Start, please. The whole area is infiltrated in the deep subcutaneous tissue. We use a single entry point that allows access to multiple dimples, the ones that we marked before. which minimizes trauma and scarring. The correct plane to go is the superficial subcutaneous tissue just beneath the dermis. Too superficial would increase the risk of contour irregularities, and if you go too deep, the septum will not be released properly. So, for example, this is our incision point. Once we go inside here, with the light source below the dimple that is previously marked, you start launching the blade. So, this is a sharp blade. So you go backward, you hold the fibrous septum, and then with another click, you convert it to a blade which starts cutting the fiber. And then once you are sure that you released all of the septums causing the cellulite, you move on and go to the next one, and you do the same procedure to it. So we'll go underneath the skin. You have a light source, it guides you through. So we'll go to this fibrous septum. So you see it is tethering the skin. I am holding it because I pressed. Now I'm gonna release it. This is done. So you have to go to the center, then lateral and medial. Now this is already released. We'll go to the next one. And with the light source here, you've reached here. So it is tethering the skin. Press one time, hold the septum, second time, you try, so see how hard it is. This is a controlled septal release and targeted toward the septum causing the tethering. Here still, it is not fully released. Now I have to check that it is fully released. Yes, it is already done. Next one, I'll go to the next marked cellulite. I have reached there. It is called, I held the septum, now I have to cut it. Sometimes you hear the sound even. The procedure itself takes about 20 to 30 minutes maximum. I'll go to the next one here with the light source. Pull it, you see the skin tethering. Now I'm gonna cut it. Then you go a little bit up. You release it. You try to release the septum fully. Do not go too superficial. Work a bit deeper. We are treating the dimples. We are not treating skin laxity. The contraindications to using Celluex is skin laxity, for example, post-massive weight loss patients, or bulging fat, the same as in cases of lipedema. Always when you go, you have to go with the instrument parallel to the skin. Do not turn it around. Why? Because you don't want the blade to cut through the skin. So we are reaching the lateral ones, lateral thigh. It's a bit far, but here it is. It is pulling on the fibers. Now we have to release it. Okay, these are the fibrous septum that we have released or taken out from underneath the skin. I use a single subdermal suture to close the skin. I don't have to remove it later on. After the procedure, the patient should wear something, a compression garment for about 1 to 2 weeks. They can walk immediately after the procedure and go back to their daily activities within 24 hours. They have to avoid massage and heavy exercise for 7 to 10 days. A bruising can last up to a month to 6 weeks after the procedure. You have to evaluate the patient again after 3 months. But the next visit in the clinic would be after 2 days to check that there are no seroma collections. Celluex allows us to treat cellulite at its anatomical cause, which is the fibrous septum. It is a single session, minimal downtime. The satisfaction rate of the patient is above 90%. It is used for moderate to severe cellulite, and most of the patients are satisfied with the result if you choose the right patient.